So our next presentation, unfortunately the presenter couldn't be with us but was able to pre-record a presentation, but the good news is we'll be available for a live chat Q&A right afterwards. We're going to speak with Mr. Craig Fuller, who's the former president of NACDS, the former chief of staff for VP George H.W. Bush, not to be confused with the other George Bushes, in Washington, D.C. He was also in California with the Reagan administration in 1981. He served 8 years in the White House as first assistant to President Reagan in the Cabinet Affairs before becoming chief of staff to Vice President George H.W. Bush. There we go. In the second term of the administration. He co-chaired President Bush's transition and then entered the private sector in Washington. I guess that's the thing to do. Leading public affairs, consulting firms, associations including the National Association of Chain Drugstores. Most recently, he served as president and CEO of the Aircraft Owners and Pilots Association, which speaks to his diversity. Complete the 5 years that he agreed to serve and remains in Washington, D.C. area as the leader of the Fuller Company, a strategic consulting group he organized when he initially left the government in 1989. He's been in active aviation policy matters, as well as has been the director of the U.S. Chamber of Commerce, where he is a member of the executive committee. And now, without further ado, Mr. Craig Fuller.
Hello, I'm Craig Fuller, and I'm pleased to be with you for the Let My Doctor Practice Summit. I know you've had a full agenda over the past few days, and much of it's been devoted to why it's important to form an organization. And I know you've focused on just what you want to fight for in the months and years ahead. Let me say up front that you're off to a remarkable start with some very able leadership. It's been wonderful to watch this organization evolve during the past few months. I know my background in politics, public office, business, and association leadership has been shared with you, but perhaps the most relevant part of this past has to do with representing the retail pharmacy community. However, everywhere I've been, it's led me to appreciate the value and the importance of coalitions and collaborations, and that's what I'm here to talk with you about today. So, thanks to Dr. Michael Strickland, who along with other physician leaders is doing something very, very important. I firmly believe that this summit will be looked back on as the time and the place when something changed. As much as I believe that you must build the Let My Doctor Practice organization, I'm here to tell you that you must do something else. In some ways, you've already started. You must work with others and build a coalition. Coalition building has been around for a long time, but it's not easy and it's not lasting without real and continuous effort. Coalition governments have formed for decades, and coalitions to affect public policy have been around for a long time as well. Usually a coalition is formed by various groups to battle a common foe. They exist for a period of time and then come to an end, whether with victory or defeat. Other coalitions are built to last. In our time together, I'd like to share some personal experiences about coalitions and collaboration. In doing so, I want to connect these experiences to actual research that's been done on coalitions, because both coalitions and collaborations have been studied a good deal over the past many years. One fascinating body of work on coalitions and collaboration comes from Robert Axelrod. He started considering collaboration while thinking about what's known as the prisoner's dilemma. Here's how the dilemma works. There are two individuals being held by the police. They did commit crimes, but there's very little evidence to convict them of the most serious crime. The two are separated, and one is told that if convicted of his crimes, he'll do at least a year in jail. But if he'll take a plea deal and turn in his partner, he will only do 6 months in jail. However, he is also told that his partner has been offered the same deal, in whichever one is turned in first as the one who planned the more serious criminal acts, that person will likely get 5 years in jail. Obviously, the quandary is whether or not to take the 1 year and hope your partner does not rat out you in his discussions with the police, in which case you're in the slammer for 5 years. The best case for both individuals is to keep quiet and do their year. So what do you think happens? Well, Axelrod got very curious about the behaviors and strategies for coping with scenarios built around the prisoner's dilemma. He held tournaments with people given dozens of different scenarios to try and understand what pattern of behavior actually led to the most consistently favorable outcomes. Axelrod found 4 characteristics that were favored, and his findings are, in my view, validated every day by looking at successful coalitions. Let's take a closer look. First finding, be nice. The concept here is that you or your group should be cooperative, or as Axelrod says, don't be the first one to defect. In the world of retail pharmacy, we faced a serious challenge several years ago when pharmacy benefit managers decided they would set up something called RX Hub to clear prescriptions in an online service. The fear of the retail pharmacy community was that this would steer patients to the PBM mail order pharmacies. A coalition was established where large chain pharmacies sat down with regional chains and independent pharmacies. While all 3 of these groups were competitors, they needed a solution that would work in the marketplace and compete with RX Hub. That solution was SureScripts, and it exists today. It came together for one important reason. It's 50% owned by the chain pharmacies and 50% owned by the independent pharmacies. This happened while I was president and CEO of the National Association of Chain Drugstores. Initially, some of the staff was opposed. Some of the board members were doubtful that this would work. But the only way to be effective in entering this marketplace was to be nice and to make sure that whatever we created helped all pharmacy operators, not just the largest. Ironically, after I left NACDS, an investment fund approached me wanting my help in acquiring SureScripts for millions and millions of dollars. The answer from one of the directors at the Chain Pharmacy Association, who was initially dubious when we were setting up SureScripts, was, no, this is much too valuable to our industry to sell. By the way, a few years later, SureScripts acquired RX Hub. There were always issues between large pharmacies and independent pharmacies, and there always will be. However, by playing nice and making the independent pharmacies full partners in a coalition, we built a coalition to last. Second finding, be provocable. Now this might sound like a contradiction to the first characteristic, but it's really not. Under the be nice heading, remember Axelrod says, don't be the first to defect. He says, don't walk away from your partners. However, if a partner is behaving badly, you don't let it go. You can be provoked, and you can respond, but don't over-respond, and don't let something escalate out of control. Going back to the same 2 groups, chain pharmacies and independent pharmacies, for another story, we were deep in the debate over Medicare reform and a prescription drug benefit. The independent pharmacy community did not want to support reform that provided coverage for Medicare patients. Without going into the details, there was no question that coverage would reduce pharmacy margins. Trouble was, without coverage, those that were least able to pay for their health care were paying the most for prescription drugs. The chain pharmacies wanted to be at the table to work out a solution, and for a time we had a coalition representing all of pharmacy. When comments were being made that were not consistent with what we had agreed upon, those of us representing chain pharmacy stepped back from the coalition. We were provoked and began taking more independent actions. The legislator literally writing the Medicare reform legislation was Congressman Bill Thomas from California, who chaired the House Ways and Means Committee. He was a very strong chairman and he was very smart. He was also a friend from California where we first met. While I'd been restrained as part of our coalition, the defection by some of our partners freed me to have a conversation with the chairman and his staff. We actually sat in an office and shared the language that chain pharmacy could live with, sitting in this private room as it was typed into the document. The measure was introduced with the language we'd asked for, and we sent a letter in support of the bill, admittedly much to the consternation of our former coalition partners. After the measure passed, we reached out to the independents, however, to work with them on implementation. We suspected, you see, that the writing of the actual regulations would be even more challenging than the writing of the bill. That was true beyond even what we might have imagined, and we kept the coalition together throughout that process. It's a good example of not moving first to defect, taking action when a defection occurs, and then stepping up first to rebuild when the opportunity arrives. Third finding, don't be envious. Axelrod describes this characteristic as being fair with your partner. I've seen this from two sides. In some cases, a large and stronger organization can benefit from a smaller one. The key is that each realizes that there are mutual benefits to come from the coalition. Let me give you an example from my days as the president and CEO of the Aircraft Owners and Pilots Association, AOPA. At the time, AOPA had 400,000 members. Early on, the president of the Recreational Aviation Foundation, based in Bozeman, Montana, called me to say like he'd be in Washington, D.C., and he wanted to buy me a cup of coffee. I suggested that I could pay and that let's have lunch, mainly because I love the West and I'd never even heard of this organization. Well, over lunch, I learned that they had 500 members, but they wanted to expand. They dreamed of having a representative in every state, and all of the people working for the Recreational Aviation Foundation, RAF, were volunteers. Their purpose was to protect backcountry airstrips that can be used by recreational aircraft. They had both federal and state issues to contend with. Well, it was a great story, and I was motivated to help even before I heard something at the end of lunch that changed the RAF and AOPA relationship forever and for the mutual benefit of both. As we got up to leave, the Recreational Aviation Foundation president asked if we had any challenges in the United States Senate, as he was spending the afternoon, quote, with Max. I said, "You mean the chairman of the Senate Finance Committee, Max Baucus?" Well, that was the one, and in fact we had huge problems before his committee with the proposed user fee from the new Obama administration. We sat back down and worked out a set of talking points. Turns out the backcountry pilot had flown the senator from Montana all over the state during his past elections. At AOPA, we embraced all that the RAF was trying to do, and over some initial resistance, we worked to help them in states with our regional team and in Washington with our legislative affairs team. We found that they had many friends in important places that could also help us. Today, the Recreational Aviation Foundation have their 50 state representatives and over 6,000 members. It validates the notion that neither organization was too envious of themselves or each other to find ways to partner. Fourth, clarity is important. Says Axelrod, don't ever be too clever, and for sure, don't be tricky. As I like to say, just be very straightforward. A coalition is like any relationship. It must be built on trust. I found that it is not even necessary that the parties always agree, but they must trust one another and honestly discuss their differences and not simply assume agreements. Clear lines of communication must exist among the leaders and their team. I learned this lesson many years ago as Chief of Staff to Vice President George Bush. As he prepared for his 1988 presidential campaign, the campaign staff took shape under the leadership of Lee Atwater. Lee passed away a number of years ago, but to the end he was one of the most talented campaign professionals I've ever known. He was also about as different from me as anyone could be, but that would take a whole other program to explain. We had known each other for several years, though, and we had a good deal of mutual respect going into the campaign. And we both knew that we needed each other to make things work. We had a pact. Nothing and no one would come between us. If one of us had any issue with the other, we'd just share it, deal with it, and move on. We had thousands of decisions to make in the course of a presidential campaign, and we had no time for the drama that makes up most campaign leadership teams. We spoke a dozen times a day if we were not together, and many times we traveled together with the vice president. It worked, and it worked for 4 years of hard campaigning. Remarkably, we became even better friends. Lee's campaign organization and my official office of the vice president had to work together, and they did. Although at first the staffs in both organizations tested this relationship. What they learned was the extent to which Lee and I were dedicated to one clear purpose, and nothing could get in the way of that. If something was developing in either organization, Lee and I just jumped on it and resolved it. The unexpected consequence of this was that the staffs, while still a bit competitive, started behaving in a more collaborative way because they knew what would happen if something drifted to the top of the decision tree, and they knew nothing would be allowed to divide and thus distract us from our mission. The other example I'd offer comes from aviation. There are two big membership organizations, AOPA, which I mentioned, and the Experimental Aircraft Association, EAA. For years, both approached each other as competitors, feeling that there were only so many pilots and so winning members meant beating the other guy. My orientation was different. In the political world, if you find someone who is active as a volunteer or donor or both, you know you have someone more likely to join the cause. And we have so many challenges in general aviation that I wanted everyone possible to be a member of one or even better, both organizations. I wanted the organizations to find ways to work together successfully. Well, this was just unheard of, and it was resisted initially by some staff members and even some board members. It required being very clear that our purpose was to advance something, not just build a bigger and bigger organization at the expense of another. The first meeting involved AOPA staff being loaded on board the association's aircraft to fly to Oshkosh, Wisconsin, to meet with their counterparts at EAA. Honestly, it took only a day. They realized there was much more to be gained by collaborating, and with a few exceptions, never looked back. I will admit, and this is important, there are temporary setbacks. Know this going forward and plan a strategy for making repairs. Give you an example. A couple of years into this new collaboration between AOPA and EAA, I'd flown out alone to see the new president of EAA and walk through the agenda we'd set for the year ahead in order to compare notes and better collaborate. He was gracious, and when we broke for lunch, I learned that he'd invited all of the staff into a room to have lunch and hear a discussion between the two of us on stage. Clearly an extemporaneous talk. We had a nice lunch. We did about 40 minutes of conversation with Q&A at the end. I got one question about what I thought we should do to get pilots more engaged. I shot out an answer saying, first, it's important that they be a member of AOPA or EAA. For some reason, my brain was moving on to my point, and I left out the phrase, or better yet, both. This was something I'd always said, but by leaving it out, it was noticed. But not by me, of course. About a week later, we learned a strategy session was convened at EAA to discuss what some thought was AOPA's new approach to win members in just one organization. It only took a call to the EAA president and an article to fix it. But this is why communication is so important. There'd been no change in strategy and no desire to weaken a very able and important organization in the aviation community. So like I suggested, have a strategy for repairing even the best relationships, because things will develop to pull organizations apart. So we learned the 4 important characteristics discovered by Robert Axelrod's research. And I hope validated these with a few of the stories. Again, the 4 are: 1, be nice. 2, be provocable. 3, don't be envious, be fair. And 4, be clear, not tricky. To close, I'll share just one final anecdote. It's one that, for me, brings all of this together. I mentioned that the general aviation community was confronted in 2009 with a very large user fee proposal from the then new Obama administration. One of our real problems was that our strength was really not known, and our contribution to the nation's economy and to communities around the country was not well understood. We elected to tell our story with a campaign called General Aviation Serves America. Harrison Ford became our central spokesman in digital advertising and print media. Our initial investment was magnified by support from others, and thus it became clear to all that the entire general aviation community was together in this campaign. And this fact produced a huge opportunity. A member of Congress who noticed the coalition asked if we would help them on the Hill build a general aviation caucus in the House and Senate. These groups exist to further discussions among members of Congress and that have a shared interest in a particular topic. Of course, I said yes, and not only would AOPA participate, we would bring all the other groups as well. I had hoped that we might get 30 or 40 members of Congress, of the 435 members of Congress, to be specific, to join. Well, because the outside groups were all together in the effort to build the General Aviation Caucus, it just kept growing. Today it numbers 252 members in the House of Representatives, well over half, and there are about 40 members in the United States Senate. This truly is unprecedented and could not have happened without a coalition. There really is so much more to accomplish when groups work together. I hope my comments and stories will encourage you to keep on your path. There is much good you can do by engaging with others to protect your ability to practice. Thanks for letting me be with you today, and thanks for listening.
Thank you very much, Mr. Fuller, and thank you all for listening respectfully to his presentation. We have the privilege of having him live now for questions via remote. So can you hear us, Mr. Fuller?
I can hear you just fine. It's great to be with you. I'm just sorry I can't be there.
Great, absolutely. It looks like a lot of fun where you are, but Keystone, Colorado is quite the sportsman's paradise.
I know that for sure. Well, we spent a week at the at AirVenture, the world's largest aviation show, and it kind of locked me up. But anyway, I'm happy to be with you and happy to answer a few questions if anybody has them.
Well, thank you. Does anyone here on site have any questions, or anyone from at home from the internet? Just type in your questions and we'll share them along here.
As they're coming in, I might just reiterate what I said in my message. I really think that what you're doing there and across the nation with this video feed, which I think is a very, very creative way to inform people and engage people, I think it's very important. I think honestly, healthcare needs this sort of engagement, and it needs your involvement. And I really commend you all for the focus you brought to bear on this over the course of the week, and I know beyond this.
Well, thank you for sharing your experience with us. Certainly, you shared a lot of your business experience and things like that. Can you tell us a little bit about yourself as you age? What are your concerns as a patient? I mean, with all the legislation that's been passed, all of the difficulties with big business interests, and everything that's going on in Washington, D.C. that's usually acrimonious since the founding of our country, it seems. The more you read, the more you learn that it was never calm, cool, collected, and academic. What are your thoughts on, as you age, what your concerns are and how physicians and the healthcare community can better address those?
You know, one of the things that I've always thought is a little bit different about me and other people who are certified to fly airplanes is that in order to maintain our privilege to fly an airplane, we have to pass a medical examination given by a physician that the FAA recognizes. It's either 2 years or 1 year, even 6 months, depending on the situation. And because of that, since I started flying at the age of 16, and I'm 64 now, since I started flying, I have routinely been involved with the medical profession. Thankfully, I've been spared any serious issues, although I have the chronic disease known as asthma, totally under control, symptom-free, able to do whatever I want to do. But in large part because I constantly see a physician, I take the medication as it's prescribed. So on the one hand, when I look at the public policy dimensions of what's happened in Washington, I think people being covered is a very good thing. But then the relationship has to be, the paramount relationship has to be between the patient and the physician. And the government has to understand that what the patient and the physician work on and decide together is a course that needs to be respected. And I worry a lot that for people who either get treated roughly by the system or they can't afford alternatives, that still the kind of medical care and attention that they need, that a physician would recommend, is going to be outside their reach. And again, I think the fact that for all of us who fly, that in order to protect that freedom to fly, we absolutely have to engage directly and trust our physicians. And I get a routine physical every year. In fact, my physician in the last executive physical I had a couple months ago said what he said to me before, which is everything came back, test all the good. In fact, you're in such good health, you should take better care of yourself, which is actually code for losing weight, which I'm actually doing a little bit of. So that relationship is terribly important. It has been for me all these years, and it will only continue to be more important as I age and as my wife ages.
But as a person and as a person who flies planes, as a person who's been in business, you take a lot of personal individual responsibility for your own maintenance in all of those sectors. How do you think we can get America to do it because legislation fails outright?
Well, I honestly think that's why what you're doing is so important. I think the patient has to have a physician whom he or she respects and trusts and engages in on a regular basis. You know, the medication today that's available is remarkable, but it's also dangerous, as you well know, and I know this from my chain drug pharmacy days. Oftentimes we do as much damage with medication as we do providing benefit when the patient doesn't take the medication properly. And so the engagement that has to occur is between physician and patient, and it has to be ongoing. It has to be a trusted relationship. It can't be something that a bureaucrat in Washington decides what's right or what's wrong. And I think that's the message that has to get across to the policyholders, or we're putting a lot of people at risk, I'm afraid.
In the last 2 minutes remaining, what are your thoughts on the direct care movement where a patient directly contracts with the physician without third parties involved, the physician comes up with an agreeable competitive price, and there's an agreement on both sides? I mean, because you've been involved with contracts for decades and decades, what's your thought on that?
I'm sort of in the position of, I want people to have choices, and I think for some people that's the perfect choice. My executive physical that I started, probably 12 years ago now, is a relationship with a physician at the Virginia Hospital Center. Insurance doesn't cover it, but I know that every year I go there, I get a very complete physical, and there's a record of everything about me. Anything that's changed is on record, and if there's an issue, there's somebody who knows my background. Other people that wouldn't work for, either through cost or through another arrangement is more desirable. But I think I think that whatever it takes to get a direct relationship with a physician that works for the patient is something we have to pay a lot of attention to. And I think I know in my area, and I'm sure I know across the country, in fact, that more and more physicians are looking for ways to build a professional relationship with a limited number of patients, and maybe that is a solution. We still have an awful lot of people, though, that are going to have to find the best medical care they can afford and that's workable for them.
Thank you. So I don't want to put words in your mouth. So you're a fan of human connectivity over electronic connectivity?
Well, you know, I actually think human connectivity is paramount and essential. I do think that the technology can help. It can help give patients information. But you know, if you don't have a professional that you can talk to, you can also run afoul of these forums and other kinds of electronic communication. So I think you have to. It all comes back to having to have a strong relationship between the patient and the physician.
Great. Thank you very much, Mr. Fuller, for your thorough presentation and your thoughtful question and answer session afterwards. Thank you.
Great to be with you. Thank you, and good luck to all of you. Thank you very much.